is Carissa, and we're going to be teaching you, that's right, you, about lung cancer and all of the different topics that go along with it. Let's get started!
So some symptoms of lung cancer are coughing up blood or a cough that doesn't go away, pain in your chest, weakness, fatigue, shortness of breath, and
awareness for lung cancer is to wear a white ribbon in the month of November, because that's how you can show that you care about lung cancer and that you want it to get fixed. Now, sadly, lung cancer is the most leading killing cancer out of every single cancer, and it's the one that gets the less amount of profit. You only get about $1,500 a year to help lung cancer patients, which is terrible because this is the one that kills most people. And also the IASLC is the awareness group that likes to take lung cancer and fight it and try to help lung cancer patients.
Now we're going to be talking about some prevention for lung cancer. So obviously don't smoke, because smoking is the leading cause of lung cancer. If you don't smoke and you know people that do smoke, just try to stay away from them, because that could also help prevent it, because you can also get it from secondhand smoking. And look into your family history, like know your genetics. That could also help a lot. And if lung cancer does run in your family, you can look up ways to prevent that. Just stay active, stay healthy, and don't smoke. Stay away from smokers. And
the lungs enable oxygen to come inside of your body and have the cells release carbon dioxide, which continues a cycle to allow the plants take in the carbon dioxide that you exited to create the oxygen for us to continue breathing and living. Now, the lungs have a certain tissue made of epithelial cells and smooth muscle cells, and that is the main affected area. The lungs are located about right here in your chest, in between your ribs for protection, and on either side of the thorax. Now, a type of treatment that you can use for lung cancer is radiation therapy, which is basically where they take high-powered x-rays and have them radiate, which in this case is to move through the cells in your body to find the cancer cells and pound on them physically to break them or to kill them. And this could leave your skin a little irritated because these high-powered x-rays can be damaging your normal cells as well. And there are some side effects that you could possibly experience after having radiation therapy, which is usually a loss of appetite, fatigue, and also if you usually get it near your chest, you could get a sore throat, cough. You can still have a bit of a fever and shortness of breath as well after, but it's one of the best therapies that you can get to fix and cure lung cancer, because this one has seemed to be highly effective in all of the type of treatments you can use. The possible causes for lung cancer is, of course, smoking and secondhand smoking, which is 80% of the reason that lung cancer patients end up in the hospital because of smoking. And the second biggest reason why you could cause or get lung cancer is because of genetics. If in your past family someone has gotten lung cancer, that means you personally could have a higher risk of getting lung cancer from genetics, from your own family. You didn't even do anything, but you could still have a higher chance of getting lung cancer, which is especially important when it comes to women, because it happens a lot when it comes to
now we're going to be
genetics.
talking about the survival rate for lung cancer. So there's actually a 50% chance that you can survive from having lung cancer if you catch it in the early stages. This is because it's easier to catch, because it's not so hard on your immune system and it hasn't really taken full effect yet. Now, the downside to this is there is also a 4% chance that you will survive from lung cancer if you catch it in the later on stages. Now, what this means is catching it in the later on stages, it depends on how your body reacts. Now, certain people their body can pick up lung cancer immediately. You will go and get checked, and then you have the 50% chance of living. Now, other people, their body may take a long time for you to actually get the symptoms and figure it out, for you to go to the doctor and for them to tell you that you may or you do have lung cancer. And it could be caught in way later phases of it, which would mean that you would only possibly have a 4% chance of living. So if you catch it early, you have 50% chance, and if you catch it later on, you only have a 4% chance of the survival. Alrighty, so now we're going to be talking about who exactly is affected by lung cancer. So according to scientific research, women are most susceptible to lung cancer, and actually it kills more women than breast cancer does, which I found interesting. Now, men can of course also get lung cancer, but women are still more susceptible to it, something in the genes and their genetics and how women are more formed more so than men are. So men can get it. Now with children can get lung cancer, but it is a very slim chance that they can get it. And if they do get it, it will be cured most likely, more so than it not being cured. And they will eventually grow up to lead healthy lives if they stay away from smokers and secondhand smoke. But if you are a child and you have lung cancer, it is a very slim chance that you will die from lung cancer. If you are an older person, say the elderly, and you have lung cancer, your chances of dying are very, very big. Now, what I mean by this is you're older, so your immune system is susceptible to plenty of diseases. You've been around, you've been prone to a lot of things, and your body is slowly deteriorating. You're not as strong as you used to be, as your immune system used to be. So if you get lung cancer when you're older, your chances of survival are very slim. Even though you can, they're very slim.